Welcome to Kentucky Horsepower, the official podcast of the Kentucky Automobile Dealers Association.
Hey, everybody. Welcome to the Kentucky Horsepower Podcast. This is a voice you're not used to hearing. It's Sarah Bishop, and I am here with Colin from Integrum Advisors, Colin Royster, and he's going to talk to us a little bit about KADS today. A lot of you all have asked, what's this new initiative? What are we doing on the insurance side? It is new, and we are excited to have Colin kind of give us a little bit of a heads up and tell us all about it today. Hi, Colin.
Hey, thanks for having me, Sarah. And for those of you I have not met, again, my name's Colin with Integrum Advisors. And it's been a lot of fun to partner with KADA to build a program that helps dealers control the uncontrollable, and that uncontrollable, as we all know, has become healthcare and healthcare expenses.
I think that can be what keeps a lot of us up at night. Certainly, dealers who are responsible for their employees and wanting to make their health insurance not only something that's affordable to the dealer, but something that protects their employees and that really serves as a value added. So tell us, what is KADS?
So this new program that Sarah and Jason have worked very hard to build is a program that we've partnered with KADA on to help customize and control expenses around healthcare. It is a program that looks at your dealership's internal resources, it looks at your goals, it looks at your health plans, and provides a pathway for a customized health plan, whether that health plan is through Anthem or it's through some type of alternative funded or self-funded plan. This program provides a pathway to a customized health plan, which not all employers have access to.
So it's different from the KADA health plan of old, which still exists in some form, but you're not locked into that exact plan, correct?
That's correct, Sarah. You know, it's interesting. We've had the privilege of working with, more than 100 car dealers, both in and outside of Kentucky. And we found that one size never fits all, especially when it comes to healthcare. So you're exactly right. Dealers now have the option or the choice of a similar association plan through an Anthem, but they also have a number of other choices, which will be brand new this year.
All right. And so tell me, if people are looking to renew, how far in advance do they need to be doing that? We're entering the last quarter of 24, unbelievably. And how much lead time do you need to help them look at their options, get some of their data together, that sort of thing?
Yeah, great question. As it's one of those items we never want to think about until it's up for renewal. But in our experience in working with dealers, having more than 60 days provides the greatest outcomes. It gives them time to make decisions. It gives them time to evaluate all their options in the marketplace. So we always say, as a good rule of thumb, 60 to 90 days is ideal. I will tell you, once you get more than 100 employees, we're finding that I'll call it high performing employers, meaning employers who do all this stuff we're talking about really, really well. Those high performing employers who have controlled this uncontrollable cost of healthcare, they're starting at about the 6-month mark in reviewing their options and their healthcare trends.
Yeah, it's probably a little different animal when you've got 100 employees.
Absolutely.
Different needs. All right, so talk to me about some of the successes that we've seen with the KADS plan. I know that we have some testimonials. We'll try to get those either put into this video or in the email attachment when we send this out. But talk to us about some of the successes we've seen with Kentucky dealers.
Yeah, absolutely. We really, over the last 18 months, have continued to work with more and more Kentucky dealers. And I'll pull just one example. And I if he's listening in. I appreciate Rob you sharing this, but the Marshall Auto Group from the Northern Kentucky area, that organization joined this plan June 1st of this year. And for the first time ever, they were actually able to offer a a base plan, a minimal plan, so that all employees could have basic health coverage at no cost. So a base plan for all employees at no cost. And they were able to have a decrease in their traditional health plan. And so this may not be the right fit for all employers, but hopefully it highlights the customization that is out there uh, to really meet all dealers' goals and internal resources. So whether their goal is to have health insurance paid for all their associates, or if they have different goals, this new plan allows that to happen.
I know Rob shared with me, I can't remember if it's in his testimonial or not, that his employees were also super happy with the plan that they had elected to go with. So I think what makes KADS so effective is not only the ability to customize it, but also you're serving your employees, you're getting better service, you're getting maybe a discount, maybe something competitive, better rates, better service, and you're helping the association when you do it. So to us, that's a win-win-win. And we hope it is that way for you all as well. Tell me a little bit about what do folks need to have ready to send to you in terms of data? Sometimes they'll call me, sometimes they'll call you. I'll put them in touch with you. What are sort of the things that they need to start compiling? Because we're just going to say we need to see this to start putting things together for you.
Yeah, great question, Sarah. First and foremost, a complete census. A complete census is insurance lingo, meaning we need a list of your employees, their date of birth, their gender, the zip code where they live, and what plan they're enrolled in that you all offer, or if they've waived coverage because they have outside coverage. And we do need this information for all eligible employees. And as a general rule of thumb, all eligible employees includes any W-2 employee who works 30 hours or more on average a week. We also, this is one that trips most dealers up on the first pass, is we also need any dependent information if they're enrolled in your health plan. So that's kiddos, that's spouse. We also need their name, date of birth, and zip code. In addition to this complete census, we also need some type of plan summary. Insurance lingo is an SBC or an SPD. But really what we're looking for, we just need an overview of what's covered and the benefits you have so that we can compare apples to apples and give you an accurate evaluation of your health plan. We also, number 3, going to need either your renewal or your current rates from your current carrier. Last but not least, number 4, which will only be for some of you all, if any claim data is available, that's certainly helpful in our analysis. But for those of you who have less than 100 folks on your plan, as a general rule, you will not have claim data, which is certainly okay. But if you have it, that is certainly helpful.
All right, and I guess we'll start closing this down. Anything else you want to share before I ask you to share your contact information with everybody?
Yeah, absolutely. Appreciate you having us on. We're excited to be a partner of KADA and bring solutions to some of these uncontrollable expenses. And as you mentioned, Sarah, we have a unique service model as well as a unique pricing model. So I encourage everybody to at least take a look at it because it should give you better service, better price, and it supports your association.
Yes, I think we can't emphasize that enough. It is certainly worth taking a look at and seeing if it makes sense for your business. Because what we found is that for almost all the dealerships that have looked at it, they found, yeah, this is a good product, makes sense. We're gonna include some of those testimonials for you so you can hear it from our dealers. Colin, how are people going to reach you?
Two ways to reach me. The first is my phone number, which we will provide it here, 540-526-7074. You can also see it in the show notes or whatever we call it on this platform.
Yeah. All right. Well, thank you, Colin, and thanks everybody for tuning in, and we will see you soon.